So we are witnessing the rise of dental service organizations, digital innovation, and the new kind of patient who is informed, empowered, and experience-driven, just like Sir mentioned. So in this next panel, we'll explore what these shift means for clinicians, educators, entrepreneurs, and patients, and how the industry can evolve responsibly while maintaining the quality and trust. Ladies and gentlemen, please give a round of applause to welcome our speakers for this panel discussion. Major General Dr. Subrata Roy, former professor, Delhi University, Zonal Clinic Head at South Delhi to Clove Dental. Thank you so much for joining, sir. Dr. Chandan Jain, founder and CEO of iCube Dental. Thank you so much, sir, for joining. Dr. Amrit Singh Aluwalia, Deputy Director, Dental, HCL Healthcare. Thank you so much. Mr. Shami Gambhir, Managing Director, Unicorn Denmark Limited. Thank you so much for joining. And now I would like to invite our moderator for this panel discussion, Dr. Professor Anmol S. Kalha, Director and Advisor at Max Healthcare, New Delhi, Co-Founder and Chief Architect, Medeva Knowledge System. Thank you so much, sir. Over to you.
It's time for lunch, so I'm not going to hold you up, but I might pose a few awkward questions to my colleagues here. And I think the first goes to my comrade in arms and General Roy. My question to you is, you served the Indian Army, you came from a public health background, we've all been a part of it. And the change, moving to a dental service organization, what are the challenges on ethics and patient trust that you faced in the younger set of people you work with?
Good afternoon. I'm Major General Subrata Roy. I'm a periodontologist. I served in Indian Armed Forces in Army Dental Corps for 36 years plus. Then I shifted to Clove Dental. And just after retirement, within 3 days, I have joined there. And obviously, influencer was Lieutenant General Vimal Arora sir. And he said that we require good professionals like you. Throughout, I have been a professor, I have been teaching. Now I think that we should have basically a good professionals in our industry. Now I just come to the point where I like to give emphasis here in that is dental services organizations, which is basically changing the scenario in India. And obviously it was there in Europe before, and it is much more organized in that part of the world. Now we are also going towards it. It is basically a trend change, and it is giving lot of standardization. What I basically want to give emphasis on, it is a game changer. It is giving a platform for many dental surgeons, those who are into profession, those who want to excel in the field, and apart from that, those who are not exactly in clinical practice. Here we are basically looking towards professionals who are managing it, who are basically approaching your patients, maybe through that is not teledentistry, or it may be directly interactions with your patients. Now here we have a standardizations. It's a game changer. Ladies and gentlemen, here I find that in Clove Dental that it's a game changer absolutely, because right now I can talk about dental surgeons. They are regularly getting trained, which vis-a-vis if you have that is isolated and independent dental practice doesn't have. Here in Clove Dental, it is in a month more than 1,500 training session is going on. you require to update yourself. You require regular updations of your knowledge and technology. And apart from that, standardizations of your remuneration. We should not forget that all of us are working for a reason to maintain our household. So that part we cannot ignore. Previously it was mismanaged, or I can say disorganized. Now with this DSO, this change is the main thing, sir. Now it is getting much more organized, and we are getting up, that is salary which is as per the NERIC rate. Even dental assistants, they are also getting a specific NERIC rate salary. That is the benefit of DSO. It is getting organized. So this direction is definitely all over the world. They are following it, and obviously it's a game changer. Thank you, sir.
Very good, Dilroy. We wish you luck. I wish General Arora luck, that maybe your bottom line and your top line meets in the middle somewhere and you go for an IPO. Because at the end of the day, you're a business, and you have to sort of come down to a point where things can... I'm going to take the next question to Dr. Chandan Jain, and he's a clinician and entrepreneur, and he's sort of working closely with patients in setting up his practice. What do you think about the expectations of patients? How do you deal with it? Do they come asking for technology, or how does it work?
That's a great question, sir. I think so. I used to ask this question to myself also on daily basis kind of thing. What patient expect from us, right? I think so. It's the mix of all three things. Technology, convenience, and also the human connection has to be there with the patient. But if I have to put it in hierarchy, I would say it's the technology. Because the thing is, all of us use Zepto, Blinkit, and all these things. Why we use that? Because we want comfort, pace in our life. This is the reason we have to move towards the technology. And we are incorporating same things in our all centers. We have CBCTs, CAD-CAM, SARAC in all our centers. Why we are doing this? Because patient doesn't really want to revisit again and again for the same procedure. So with the digital scanners and all the digital planning, we can show them the final results before even starting the treatment. So anxiety part has really decreased a lot. Patient's comfort has increased a lot. I think so. This is what patient demand from most of the dental clinics nowadays. So technology becomes the major part, and convenience, I think so, is a byproduct of it. So it's the byproduct of the technology. When we use the technology, patient automatically gets very, in the comfort zone. Patient feel at home. The dental visits should not be like dental visits. It should be like, they should have a good experience in the dental clinics. But because we are in clinical practice, we cannot take the human touch out of it. Along with the technology, we have to have a very good, communicating dentists, which are filled with empathy. They know how to communicate the right thing. They should not be selling things. They should not be in hurry. Yes, it's a business. We need to make revenue out of it. But we have to give the patient the value they are giving us. So a good human touch has to be there. But I think so in recent time, to pace up the dentistry, we need to incorporate technology in all the dentists. All dentists should incorporate that, which we have done in our all centers at IQ Dental.
I think that's very well put, and I think I completely appreciate. The reason is, it's not about the business, it's about adding value to what you do. Dr. Aluwalia, you work with an integrated healthcare ecosystem at HCL, am I right?
Yeah, that's correct.
So what do you think about dentistry coming in with broader health perspectives? Is there some move on that?
So, to answer that, first of all, I was sitting there listening to Dr. Kohli, listening to yourself, and I was actually feeling that I should be standing here with you. Because when we talk about an integrated care system, HCL Healthcare, we are doing the same thing, right? So, the necessity to provide personalized, proactive care, for rather an oral, holistic approach to our clients, patients, customers, however you want to put it, you need to move on from the conventional drill and fill techniques. So in dentistry, we see in private practices, smaller units, we've been practicing the traditional techniques. The patient comes to us with a problem, we treat it, the patient walks out. But what we have to do is, we have to get into a more holistic approach. When I say holistic approach, we work on a preventive health check kind of a scheme, right? For corporates, for retail, for everything. So when a patient, for an example, when a patient walks into one of our clinics or one of our dental rooms, the patient suppose complains of bruxism, our doctor straight away does not offer him a splint or maybe an occlusal adjustment or anything. He has something called as the electronic health record, which is a standardized thing across all our centers. So he may be in Bangalore, he may be in Chennai, he may be in Noida. He can simply access and see the patient's systemic records, the patient's psychological records, if there is any medical history. Maybe he's on antidepressants, so maybe he's clenching without knowing. And if needed, he can even be recommended to a psychiatric or a psychologist, psycho consult, just for evaluating the stress levels. We all know we are in corporate healthcare. So it's not just about treating the symptom, it's about treating the etiology. When in our setups, the basic thing that we really are reshaping the patient's expectations. We have a standardized process, we have a standardized screening, we have a standardized service delivery, which is same across all our centers. We even follow the same hygiene practices across all our centers, which is monitored by a quality team. We have a learning and development team to train our doctors, to train our dental assistants, even to work in conjunction with medical specialists. So the ultimate goal of your patient, which when very rightly said by Dr. Jain, technology is the future. You cannot avoid it. So if we see AI is developing, but what is the biggest problem in developing AI? Like Dr. Anmol said, companies come to us, they sell us technology. But what is the research behind that? The problem with developing AI in dentistry is standardization. We do not have a good standardized set of data to correlate and develop a technology. We are developing, we are reaching there, but I believe we are still short of it. And yes, in another couple of years, I think we should be there. And saying that, I think we've been doing it for the last 8 years. We serve more than 100,000 plus customers a year. And we think we have been, we're almost there in changing people's lives, not just in dental, but as a holistic view.
Thank you. I think that's very well put. And considering the fact that I am a part of a startup where we work with AI in healthcare, I think it's very important that everybody records outcomes, because otherwise you purchase a treatment and walk out like you're walking out of a shop and nobody knows what is the impact of the technology you've used or the treatment you've used. But great thoughts. So I come back to my friend and somebody I've dealt with for many years, Mr. Shami Gambhir. You're at the back of it. When we've run into trouble, I've had to call you and tell you, listen, I can't attend to my patient. Things don't work. Tell me, how do you think there's going to be a change in the way practices and DSOs and hospitals like Max are looking at technology? Do you feel there is a change, in the expectations coming from you as one of the biggest suppliers to all of us? Without you, we can't function. So what is the change that you feel?
Yeah, thank you, Dr. Anmol. Actually, things have changed from equipments to digital workflows. 3 decades ago when I started, there used to be equipments, there used to be X-ray machines, but there used to be manual X-ray films. There used to be OPG machines, but used to be the manual films. You used to see on those films. But today, very advanced level of digital cameras, digital OPG machines, digital CBCT machines, softwares, intraoral scanners. All these, face scanners, all these have made the total treatment into a very, I'll say, systematic digital workflows. And that has really made the practices, I'll say, more responsive. They can have more predictable treatments, and patients also get a lot of information of the, as soon as he enters, his good quality digital photographs are taken, maybe OPGs are taken, and then through those details, the treatment pattern or the issues are explained to the patients. He also feels confident, yes, okay, the dentist dentist is simply telling him something which he cannot visualize or for which he is not aware of. He can see all those things. And then once patients accepts, the second round, like intraoral scanners, that is the basic thing, intraoral scan is taken. And after that, then there are plenty of softwares like maybe digital smile design, or maybe ortho planners, and then maybe AI-based reports. All those are automatically generated, and that's explained to the patients. And after that, in the next treatment, as I said, like then still everything, most of the treatment can be planned in the computer itself through the digital format. So everything is very predictable. Patients also feel very confident. So that's how the things have changed during last 3 decades, which I have seen during my, I'll say, career when I started 3 decades ago. Now, what's the role of Unicorn? See, technology, as Dr. Anmol also mentioned, that all technologies are not good. So technologies keep on evolving worldwide, but all the technologies may not be suitable specifically for the Indian conditions. And selecting the right product, that is the first responsibility which we take. That's my personal involvement into those, studying the aspects, all the aspects of those products, then how those have evolved worldwide, whether these are rightly priced for the Indian market at this particular time, or still it's the initial part where the technologies are so expensive. Then, of course, just getting a technology product doesn't solve the problems. We need to have the trained manpower within our organizations, whether it is engineers or whether it is the dentists, which we also have in our team. Even some of them are even the MDs dentists also, so that they can understand the clinical aspects of that. It's not only that they can go and explain, our sales teams just simply go and explain the features of the product. No, it has to be related to the clinical aspects. And once a customer purchases that, then the trainings are needed, so that simply buying the product doesn't solve the purpose. Ultimately, he needs to be trained, he needs to be a little bit monitored. I'm not saying they're intelligent enough, they can do everything, but still they need to be a little bit monitored whether the things are going in the right direction, they are using it, or in case they are facing any issues, then those further trainings or webinars or maybe courses are organized so that they they start using those products to a level which is really, really useful for them as well as for the patients. And finally, of course, the after-sale services. We sell equipment, so after-sale services are very, very important. For that, of course, we are known for our best after-sale services. So a trained team of engineers along with the availability of the ready spare parts. So that's where is the role of Unicorn. As you said, that we are behind the technology. So all that we take care so that the actual clinical use which a clinician has to do, or which a hospital has to do, is performed as per the expectations, as per their satisfactions. The patients these days are highly informed. As you also mentioned, that as soon as patient comes, he has already gone through a lot of things on the Google or through some other social media channels and all those things. So having these kind of products, digital informations, and the records definitely gives a lot of confidence to the patients. And that is what I'll conclude is that is absolutely a must these days, that switching over to the digital workflows, digital technologies, digital methods is absolutely a must for all dentists these days, because patients expect that.
Thank you, Shamiji. So we can say that behind every successful dentist there's Unicorn.
Thank you very much.
Anyway, folks, we need to wrap up. So we're going to do a quick, I'm going to ask you one question each and we're going to close the session. So, General Roy, one leadership quality that can help Clove to thrive in the Indian context. Quick answer, 2 words. One leadership quality that can help Clove to thrive in the Indian context.
It is mainly, I can talk about, it is integrity, trust, and also I said it is your patient's confidence.
Thank you. Dr. Jain, one innovation you believe that will redefine the patient experience in dental care? One innovation, in your opinion.
I would emphasize on the same thing. It's the incorporation of AI in the digital technology.
Okay, so you think AI, so I'll talk to you about AI after this. But, okay, Dr. Ahluwalia, one systemic change that can strengthen the whole oral health network and framework in the Indian context. One systemic change.
I think that would be universal adoption of an interoperable electronic health record. Something like one man, one Aadhaar, one man, one EHR.
SNOMED CT, we've been working on it. Hopefully it will come something. Mr. Gambhir, one technological shift that has truly transformed the way Indians' dental practices function. One, you sell a lot. Just give me one which has changed everything for you and for all of us.
I think chair-side digital planning, that is one thing which has to be incorporated, and that will definitely change a lot.
Thank you. Ladies and gentlemen, it's been a very, very interesting panel discussion. We've had a representation from all segments, from healthcare service providers to DSOs to the industry. And I think there's going to be a serious need for collaboration to look at holistic health, to understand patient expectations, to be a little ethical about advertising, to understand what expectations do you build in your patients. They should be realistic. And of course, the backing from the industry, that it's not only their job to bring in technology, but to bring in technology that is, is going to be applicable in your environment, which he made a very valid point. I mean, I travel the world and you can't look at technology working there and you say, I'm going to bring it to India. You need things that are going to survive and succeed. So I think it's been a great afternoon, and I think everybody's hungry, so I think we're going to wrap up. But thank you very much, gentlemen, for being here and for giving us your valuable time and your thoughts, which I'm sure will find a lot of home in people sitting here. Thank you.
Definitely. Thank you so much, sir. And thank you to all our panelists for this clear picture on how patient expectation digital platform and DSO are shaping the way dental care is delivered and experienced. Now, I would like to request Dr. Kalha to please felicitate the esteemed panelists for this panel discussion. Major General Dr. Subrata Roy. Let's have a round of applause for our panelists. Dr. Chandan Jain. Dr. Amrit Singh Ahluwalia. Mr. Shami Gambhir. Now we would like to thank Dr. Kalha for amazingly moderating this panel discussion and for the insightful presentation we had just before this. Now I would like to invite Ms. Pinky Chahar to felicitate our moderator. Definitely. Let's have a group picture.